I've been really passionate about prevention and mental health promotion, which means trying to support people in looking after their mental health and practicing, healthy routines before it becomes a problem. That's one of the things that's a huge opportunity, and is a great way of using apps to teach skills and promote broader awareness. But mental health is relevant for 100% of the population.
Yes, if you have a brain, you're dealing with it, right? Same thing when I talk to people about dementia. I'm like, do you have a brain? Then you should care.
Yeah,
But
exactly.
so I want to know what brought you into this field. Why are you so passionate about mental health?
I'm passionate because I had a pretty serious mental health disorder. I had an eating disorder, anorexia nervosa, when I was an adolescent and in college. And it's something that once you learn about different types of mental disorders, there's some that are really hard to treat. And I got better pretty fast once I got access to treatment. And so what that left me with was, one, this deep determination to try to prevent anybody from going through what I went through, and this feeling of, this must have been preventable. If I responded to treatment so quickly, clearly I was like a sponge for learning and, this. So I tried to figure that out. And that's actually why I went to Stanford for graduate school, for postdoc, became a faculty. They couldn't get rid of me. But I really was interested in trying to understand, how do we actually prevent the onset and progression of mental disorders, and how do we develop evidence-based ways of promoting mental health for people. That's what I mean when I talk about prevention, early intervention, is everybody needs these skills, and yet we only wait until people have suffered for a really long time and had their lives, destroyed in the process. And the data shows that people wait on average 11 years from the onset of a mental health disorder, meaning that they already have significant impairment in their life is already impacted, they're in a lot of distress. So from that point, still 11 more years before getting help. So we're in a pretty bad state in terms of how we look after people's emotional and mental well-being. As you talk a lot about, we've got a long way to go in how we support the brain.
Yes, and it's so intertwined with, if you take care of your mental health and all these other things, of course, but it helps you with, preventing dementia or the onset of dementia and things like that. So it's really important to be aware of our mental health and to ask for help and to not wait that long. And that's why I like to share a lot with my community about mental health as much as possible, because I can't imagine being a family caregiver, someone living with dementia, and having that stress and that the hardest job on earth, on top of being a human